I'm a member of the Navajo Nation. We have 4 main clans, in case there's some relatives listening out there. Initially I was hesitant. I really wanted to wait and see how the research looked with the outcome, to see if it was effective, see if there was a lot of adverse reactions to it. But I also realized that people back home were getting the shots, my colleagues were getting the shots that eased my own anxiety, and that's what led to me choosing to get the vaccine shot. I am glad I got it, because I have this sense of relief. I haven't seen any family since the pandemic, so the last time we had visitors was since March of last year. So I do recommend the vaccine for my patients. I really see a lot of veterans take the extra measure to take care of themselves. They come to the appointments early. They walk, exercise. They have daily routines that really gear towards a good quality of life. And with this COVID-19 virus, it has thrown us a curveball. Had to really work on changing our perspective to get through this pandemic. And I really think because of that, right, this vaccine would be really helpful. And I think it'll help our quality of life in the long run. We've changed. We've had to change certain things throughout our lives. We've had to adjust and modify to make it this far. Our ancestors have done their thing to get us to this point. And I think this is our way of continuing also to hang on to what we have, but also this virus just impacts us so differently that our genetic makeups all vary, and for some reason it may impact certain groups more. So I really think this vaccine can be helpful in that way, is to at least lessen the symptoms and avoid us from getting to the ICU. When you drive out to the Navajo reservation, you do see cleaner air, you see less busyness, and as you go there, though, you'll also see some level of poverty. So growing up, my backyard was the Grand Canyon. I spent a lot of time playing there. So if we keep that kind of thing in mind, right, we're dealing with not just this pandemic, right? We've already had to deal with commuting pretty far just to have a job, or just to go grocery shopping, or going to our neighbor's house to use their internet. We've heard people saying, my kids hang out at McDonald's because they have internet there. So those kinds of things I think have come into play. And the other thing too, with historical trauma, if we keep that in mind, there's been some individuals that have always had some level of anxiety or fear to use the hospital. The hospitals in the reservation are available for all Native Americans. However, right, if there's been some historical trauma, some will wait until the very last minute. Some will also utilize other types of health care. I'm using like medicine men and medicine women. At least for the Navajo Nation, we've lost so many. And I share this, but I've lost 7. Sorry. I've lost 7 relatives. And one, she prolonged medical treatment because she didn't want to get sick. So she may have had some hope treating her symptoms if she went sooner. My mom was hospitalized. My sister, one of my sisters was hospitalized, and one of my sister's spouse was hospitalized, and a handful of us in my immediate family had the virus also. And a lot of my relatives have recovered from it. But we've also lost 7 total from my mom and my dad's side. I think it's the combination, intergenerational adversities, including stemming back maybe from the 1800s, like this whole colonization, assimilation, the forced boarding school era. We talk about the boarding school era as if it happened in the 1800s, but My mom said she was picked up when she was 5 years old and was taken to a boarding school. That's one example of historical trauma. And part of it is that we have a large nation, right, in a lot of rural areas. And we don't have running water to go to these different places or electricity. My message for those people that are hesitant to get this vaccine for COVID-19 is that it is something we don't take lightly. And not only that, right, is that this virus has been a pandemic because our own behavior, right? We, as human beings, we're creatures of habits. We have routines because it helps our brain conserve energy. But also some of these habits or routines, right, could also involve going to the grocery store or meeting up with a family member to have coffee. Because of these habits, I really think that this vaccine can help us, right, to someday find a new normal for us. But also, if we catch ourselves doing something because we're on autopilot or it's because it's our habit, this can ease some of our own anxiety, and also it's a shield for us to do these daily journeys and help one another.